In 2001, I was asked to take over a shelter of veterans at the Northampton VA hospital that had failed. All the money had been taken, the place was racked and ruined, and the VA really wanted to close it. The board of directors came to me and asked me if I would like to run it. And what I didn't realize at the time, I was doing the reintegration aftercare for the Berkshire County Sheriff's Department and also working with the other 4 sheriffs of Western Mass on their reintegration aftercare. And I was the largest supplier of veterans to this homeless shelter that had failed. And what I began to realize as they talked to me was that 8 to 12% of all the men in prison were veterans. I was shocked when I got that number. And I was shocked that men and women that had been veterans were being incarcerated because of both their addictions and mental health issues, many of which were exacerbated or started when they were in the military service. So in 2001, I took over a 120-bed shelter that was at about 40% capacity. I terminated everybody that worked there my first day at work. That's how I started. And I told my wife I'll be home at the end of the week, and I spent 5 days and nights working to keep that place open and get it set the way I wanted to. And what I had learned in my life in serving people, I've spent most of my life working in addictions, working in jails and prisons, and even when I went off and ventured into other things, I was always taking phone calls at night and working with people, trying to help them through the difficult situations in their life. And I began to realize that I really had a desire not just to serve people, but I wanted to impact and change in a way. It made no sense to me that in the most beautiful, wonderful country in the world, we incarcerate people at 3 to 4 times the average of most other countries. And it seemed to me that we tend in America to criminalize behaviors we don't understand. And so it was true for veterans. So I take over this shelter. I finally get some staff in there to work with me, and we get this place up and running. And my goal was to run the Holiday Inn of Shelters. In a year, I had the Holiday Inn of Shelters. I was at 115% capacity. And like many other places, when you came in and you had decompensating episodes, you went back to using drugs or alcohol, or your behaviors became too difficult for us to manage, we would discharge you to other facilities. And that really started to bother me. And I realized after about 1.5 years of running the place, you know what? We're really good here at branding failures, failures. And I realized there was a lot of insanity to what I asked people to do every day. Think about this. 88% of the men and women in my care have had an addiction issue. 84% have a mental health diagnosis. 72% have some form of diabetes. 68% have some form of hypertension. And on it goes. Average age of death of somebody in my care is about 67. So I looked at that and I think about it, and I'm saying to people that are alcoholics, I don't want you to drink. I'm saying to chronically mentally ill people, your decompensating episodes are unacceptable. And I said, this has got to stop. So I met with my staff and I said, hey, we're the highly paid professionals here. We're going to be responsible for everybody's failures. And if we're responsible for everybody's failures, we're probably not going to throw them out, because we don't want the community to know we fail. So it became our job every day to come up with strategies, systems, and understandings that allow us to keep people in our care so they can manage to a safer place. And what I realized as I did that people stayed. I went from 1,000 intakes a year down to 350. And I said, wow, this thing's working. It worked so well in 2004, the VA gave me the money to buy an old nursing home in Pittsfield at 360 West Housatonic. We put 60 beds in there and filled them the next night. Boom, got it up and running. Had a young guy come up from DC. His name was Major Ed Kennedy. He was working in the Pentagon, and he came up to do the dedication speech. He was 31 years old. And at the end of his talk, he said, I'm Major Ed Kennedy. I'm 31 years old. I'm a graduate of the University of Virginia. I got 3 kids. I'm a left-handed golfer. I love playing softball. And he finished up and he said, and I'm going back to Iraq. and I will die for you. And when he said that, what went off in my head was, oh my God, all 200 men and women that were in my care last night said they would die for me. I never had heard that. I went home that night and I'm thinking, God, there's 23 million Americans that are veterans. Everyone that put on the American military uniform, whether they meant to say it or not, said, Jack Downing, I'll die for you. I never had heard it. And as I laid in bed that night, and my wife and I had raised 9 kids, put 6 of them through college, had a great life in this country because of what veterans had done to maintain our dignity and our freedoms to choose. And I said to my wife, think about this, hon. I'm making a great living, and I think it's okay for the men and women that guaranteed that all of this to live in transitional housing, to wear used clothing, to stand in line for food, and they had to be grateful for it. What's wrong with that picture? I went in the next day on a Monday. I brought both communities together. I said to them, I'm ashamed to say this. I never realized the commitment you really made to me and to everybody in this wonderful country. And I know in a capitalistic society, if you own where you live, you're never going to be homeless. And I said, I'm going to build ownership units for you people. I'll figure it out, guys and gals. And I went off. I thought I could build condos. I went down to D.C. and found out the federal government doesn't fund condos for affordable housing, okay? But they led me to a model called limited equity cooperative apartments that acts as ownership and that gives individuals the sense that they own while living in a community of people. Normally in our country, limited equities are built by people of faith communities or people of ethnic communities who have similar backgrounds, similar needs, and they're very successful. So I went down to New York. I visited Greystone in New York City. I visited a number in New York. Found out the Lutherans out in Minnesota have limited equities everywhere. Went out there and visited the Lutherans and learned a lot about it, and came back to the soldier on and said, this is what we're going to do. And so I started on that journey. But along the way, I found out that building the housing was going to be a long, tedious battle. But I had another battle was, how do we deliver services to people every day and make it successful? And I realized, my God, I got to turn this whole system upside down. 35% of all the appointments in the community of need generally are missed. Whether they're for food stamps, mental health, addiction, whatever. 35% of all appointments are missed. Why? Because we're asking people who are either chronically mentally ill and or addicted with a number of other issues to remember to keep their appointments, and then we expect them to somehow transport themselves to those appointments in a timely manner. 20% of the people in my care have a valid driver's license. 11% have a motor vehicle. So I look at those things and I realize, I've got a lot of work to do while I try to build housing. In America, we deliver all services to people in need on the medical model. So I blame the doctors for all our problems, okay? You came up with a model that looked pretty good in the medical world, but it doesn't work in the social service delivery system very well. And I realized, oh my God, I got to start to learn to deliver services where you live. And I got to figure out how I do that for everybody in my care, whether they live in a building we control or they're out in the community somewhere and we got to go find them. Because when you deliver services to people where they live, and if you can't deliver the services to them where they live, if you can deliver them to the service, guess what? Here's what happened to us. Decompensating episodes for chronically mentally ill people dropped by 86% in our community, just by getting most of those folks to their appointments regularly and setting up a system to monitor their meds so that we knew when they were taking their meds and we could step in and help them make better decisions. We found that alcoholics and addicts relapsed probably, I think our average across the whole program now is about 28% less when they're getting to meetings and services, talking to counselors on a regular basis. We found that veterans who got to their medical appointments, we found that they never kept primary care appointments, they only kept emergency appointments when they were really sick. So we started wellness. We partnered with Berkshire Health Systems, Canyon Ranch. Think about it. Huh? And we brought wellness to veterans as a concept. In our women's program, we have a wellness director, full-time. That's all she does with the veteran women. And what we found again was this is how you stabilize communities. And then we had to accept the realities of the community we served. Most of the people felt, oh, these veterans, once they get on their feet, they got to go back to work. When you've got to keep 5 or 6 appointments a week, when you've battled through chronic mental illness and addiction, when you've had health problems, I would suggest to you that a reasonable goal might be 15 hours a week of work. And so that's what we settled on. And when we say that, a lot of people say, well, I just can't believe it. You give them beautiful housing, they have nice. That's right. That's right. That's what it takes to stabilize people and care for them. And guess what? People living in their own housing with services deliver them cost the VA and Soldier On around $11,000 a year. 1 year in a shelter, okay, just for shelter and food and staff is $42,000 a year. We deliver, even if you're in congregate living with us in a shelter, we deliver services in the room you live in. You don't come, my staff doesn't have offices. We employ nationally in the 6 or 7 states we're in now about 225 people. But what we found out was that we give wonderful service and care to the men and women who live in housing we control and live in transitional with us. As we went out in the communities over the last 5 years, we're the largest provider of a new grant system under the VA called SSVF, Supportive Service for Veteran Families. The idea of the grants come in $2 million blocks. There's only about 150 of the grants in the country. Soldier On has 8 of them. What we do is our job is to go out and identify veterans at risk of homelessness, maybe in need of rapid rehousing, generally not getting services from the VA, and generally probably in and out of some local courts. And when we identify them, we control, in our system now, we have an 800 number that you call where a homeless vet answers that. A guy by the name of Dan Klaus, who's now worked for us for 6 years. Kind of an aside to that, Soldier On employs 228 people nationally. 72% of our workforce are former clients. Veterans that have recovered and done well. I have veterans that have, think about it, guys that did time in prison who are now counselors, who now have their certified alcohol and drug in Massachusetts. They have degrees from NCLA or the Elms, okay? They work as counselors, they work as peers. We're training all over the country to do this. Soldier On has found out that what we've had to do to establish a really powerful presence is develop a permanent workforce of highly skilled, both professional and non-professional staff, and we've had to educate them. So at Soldier On, if you're an employee, we pick up 100% of all your education. And we make you, when you're bright young people, we make you get your master's, we make you choose to get your doctorate, because we know we can't get the men and women in our care to go to school, but if we culturally enrich the environment every day with new thoughts, new ways, we'll continue to discover ways to serve people effectively, help them manage better, help them stay stable, and help them get to the life they choose, not the life we choose. That was the other hard part of this model for me. I spent all my life telling people what they need to do to change. You know what? I found out I had to love people the way they were. I found it out in a very hard way. I have a 31 1-year-old son, Michael, whose both birth parents were mildly retarded, and Michael came into our life at 8 days old. When Michael was about 15 or 16, as a family each night we would say prayers of thanks for just getting everybody through the day, and I was usually very thankful that none of my kids had jumped off the deep end on me. Do you know what I'm saying? So I was grateful. But one night, and I usually prayed something at the end like just saying, and I really would say, I'd like to ask God to really heal Michael. And one night, my wife Mary, this small young woman who I love dearly, and I say that, and she waits till the kids clear the room, and she says to me, "I'm sick of you talking about getting Michael healed. Why can't you love him just like he is? Why does he have to be better for you to love him more?" And it hurt, because it was true. And I realized then, and I realized as I grew in my work, I have to love people the way they are. I have to love men that beat their wives. I have to love men that are violent. I have to love women that have hurt their children. Because if you don't love them, you can't touch them and they can't trust you. The process of transformation only takes place when people feel this can't be broken. Soldier on, we're committed when you come in the front door to serve you the rest of your life, no matter what you do. Outcomes don't dictate our commitment. We build beautiful, affordable, sustainable housing for our veterans. All our units are 1 bedroom because, think about this, we have serviced in the past year 7,000 veterans nationally. Only 11% of them have a significant other. Okay? Because when you're chronically mentally ill and or addicted, you drive away all the people in your life over a period of time with your behaviors. But the only way you leave our housing is death, generally. So much so that at all our housing, we build columbariums to inter the ashes of the veterans, because our veterans won't even go to state military cemeteries. They said to me when the guys first started, of course I never planned on people dying, right? And so guys die, I say to them, "Hey, look, we got to go to Agawam to bury our friend Gene Vereen, was the first guy that died in our housing." And we got there, and that was it. So they came to me and said, "No, we want to be able to visit him every day." So the end of the story for Soldier On is this. We're growing. We think we'll continue to grow. We love the idea that we serve veterans, and we think the impact of our work will extend out to the rest of the community of care, because we've got to learn to meet people where they are. Thank you.